I'm Dawn Thilmany with Colorado State University, and we've been hosting a series of webinars ever since the COVID outbreak kind of occurred. Just to give you a little context, we at CSU have a long history of extension, and that's part of my role here at the state. But more recently, in the last decade or two, have really tried to ramp up our level of engagement with communities. And that's just a pretty fancy way of saying we're trying to make sure that we have great communication coming into CSU to help frame our programs and make sure we're working on the right things, and all in an attempt to help build capacity in our communities. So recently, I've kind of moved some of the work I've been doing in the Regional Economic Development Institute that's hosting this webinar, and found ways to connect better with a lot of engagement partners, including the Family Leadership Training Institute and some of the people you're going to hear from today. So as part of this series, we wanted to highlight some of the great both work that they've already done and some resources that they can make available for communities. For those of you who want to stay connected with us, the Regional Economic Development Institute is our applied research arm at CSU now, looking at community economic development. We work with a lot of state, agency, private, and nonprofit partners. And again, these webinars are just one of our more recent activities to try to connect you. And we're the ones who will make sure you get access to this webinar after the event, and that you can always feel free to reach into CSU if you have any questions. Next slide. So with that, that's all I wanted to share with you about what our broad goal for these webinars and our engagement activities at CSU are. But let's spend most of our time today hearing from our speakers on how they engage diverse stakeholders in community planning. And we're going to hear from 3 different folks about both why we feel it's important to have engaged stakeholders involved, a case study from Sahuach, which I'm sure I didn't say right, about how they're doing it well. And then we're going to let Patty end with some of the resources available from us here at CSU if you want to bring that same type of activity to your community. So with that, I'm going to turn it over to Erica.
All right. Thank you, Dawn. So my name is Erica Sandoval, and I am part of CSU Extension on the Front Range. I am looking at the diversity and inclusive engagement practices of our Front Range staff and how we are engaging in programming. And I want to thank Patty for inviting me here to speak today. I'm just going to be really highlighting some of the big inequity highlights that have happened here in the state of Colorado specifically that may transcribe to some of your communities as well. So what we're going to look at here is how COVID-19 has impacted the local community, and then we're going to look at specifically a rural county, the Sahuach community in Colorado, and then Patty looking at the stakeholder engagement. So I first want to start talking about the inequities that have surged with COVID-19. These are inequities that have already had been in existence within here in the state of Colorado, and a large of this is a reflection of what's happening across the country. If we look at communities of color across the country, a lot of what is occurring, we have a lot of Latinx communities, Black communities, African American communities being affected across the country. What happened in Colorado is that there wasn't research studying immediately to look at the demographics of who were the communities affected, kind of what we saw in New York, where the numbers were already starting to reflect New York City, with the predominantly Latinx community being affected, with 43% of their cases being of the Latinx community. Here specifically in the state of Colorado, Colorado is very interesting. It's the 9th largest state with Latinx community members across the country. You will hear me start saying Latinx community, and by that I'm using interchangeably with Hispanic, Latino, Chicano, but I'll be referring to Latinx for an inclusive lens here today. So in Colorado, the Latinx population make up 22% of the population of the entire state, and encompassing about 36% of the COVID-19 cases, and we're looking at 23.7% of deaths. And again, these are numbers that have been reported. It's been really tricky to look at numbers specifically within COVID because a lot of the numbers haven't been reported, lack of testing, and I'm going to go into a little bit about how those communities have been affected, specifically looking at the Front Range. In the state of Colorado, one of the largest inequities of the communities we've seen is Boulder County. So anyone that's familiar with Colorado, Boulder County, Latinx encompass only 13.8% of the population, but as a county, there's accounting for about 30% of the cases, and nearly a third of them are being hospitalized. What makes the numbers here also quite outstanding for the state of Colorado is Colorado has, in the next 20 years, it's predicted that the population is going to increase to 33% of the Latinx community. So we have a very large young population of Latinx youth, and that's not from net influx of immigration, but that's from an aging population of our white population and our influxes of our youth increasing. Some of these inequities reflect a lot of some other communities across other states. For example, in Utah, where about 34% of the state's population of Latinx are being affected, and those are a large number of farm workers. And then also, I also don't want to take away from the disparities of the African American population here in Colorado, especially in the Front Range, but I'll be specifically focusing on these numbers today. So one thing to really keep in mind as we're starting to look at the inequities that's happening with COVID-19 is looking at workplace and what is happening in the workplace. And this is a large reflection actually across the country. But again, I'm going to be speaking specifically to Colorado here. When we look at this, the Colorado Health Institute, CHI, did a study on social distancing. And what they found is the categorization of 10 types of industries in the state that are deemed essential. As you can see, some of these essential jobs are also the ones that are also categorized across the country, where a lot of our immigrant and communities of color are working in some of these sectors. As a population with the immigrant as a whole here in the state of Colorado, we have about almost 32% of the population who works in grounds, maintenance, construction, these type of industries. Farming and fishing, production, etc. So again, as you start to reflect within your own counties and you start to see this is a large number where people are not able to social distance because of the way people have to stand at work or some of the proximities of what that is. Even though we may have the largest numbers that we're seeing in COVID in the Front Range, these communities and these reflection of these sectors are a large reflection of the rural population here in Colorado, where a lot of these jobs are. It's important to highlight that at least the H-2A workers, we're a large population. These are going to be our migrant contracted workers who are working in places as in the southeast corner of Colorado, the San Luis Valley, and also in corners down on the up on the western slope. So these the inequities has caused some of these H-2A workers also not to have access to some of what would be worker protection that some of the other industries might provide. The worker protection also has been another key point in some of the other type of industries that are affecting here in Colorado. And just to kind of break down the inequities that were already existing within the communities of color across the country and specifically in the state of Colorado, these are margins that perhaps Lori will be able to speak a little bit more about on how some of these issues specifically are affecting these communities. So when we're looking at technology and as we're starting to reamp everything so digitally and we're starting to go electronically, really starting to think about the digital divide that is occurring within these communities. So 16.2% of Latinx population here in the state of Colorado are unable, or the only ones that are able to actually telework. And there's been an influx of some corporations wanting to bring Wi-Fi and internet to a lot of these communities. And it's important to note that 2 out of 3 of the Colorado age school children who are without internet right now are Latinx here in the state of Colorado. And these companies that started to step up and help out, they're one of the largest inequities that was happening, especially in the Denver metro area where a study was conducted, was that some of these communities were unable to access the internet, one, because they perhaps don't have access to an internet. It's a non-English speaking household, unable to never owned a computer and accessing with a social security number. So a lot of these type of aids, as we're starting to think about how we're providing services to community, by requiring a social security number, it puts another barrier to a lot of these families, especially in the current political and economic climate that these communities are living in. And then health, a lot of health disparities that we can talk about with communities of color, health conditions pre-existing that are happening. And then I'm gonna speak a little bit about accessing health and then access to PPE, so personal protection equipment, and a lot of these work spaces that I was speaking about. For example, testing, even though testing was allowed in certain counties, testing was given, the cost of the testing was hindering a lot of community members, and again, what information was being asked during the testing. One big thing that I want to talk about specifically to this webinar is the aid relief and the economic impact that these communities have had when we're looking at communities of immigrant, Latinx, communities of color. So for a lot of these community members, there's no paid sick leave and the type of industries that they may live in. So H-2A workers, those that may work in the meat packing or processing plants, those working in the service industry who may be undocumented. And the CARES Act specifically that gave families a $1,200 assistance, specifically this has also given a barrier for a lot of communities and families who live in mixed status families. And this has been a big push by a lot of advocacy groups in the state of Colorado as well as other states. We've seen, for example, the governor of California go in and help with some assistance with undocumented folks, the mayor of Chicago. What happens with the mixed status family, so if someone is documented and is married to someone who is not and has filed an I-10 and filed jointly together, that prohibits them from receiving the $1,200 CARES Act, as well as unemployment benefits. And also, I want to just really highlight the situation with public charge. A lot of individuals working with communities have been the voice for a lot of these families and communities on how to access some of these resources. What public charge is, it was brought up in February of this year, right in the middle of COVID. The administration put a cap on anyone who was wanting to apply for permanent residency, or which would be a green card, or in process of legal citizenship, and anyone who accessed any type of resources, then it would be used against their application. So what public charge has done is created a large fear among a lot of community members to access, like I mentioned, even technology, because of the fear of accessing a social security number, accessing any type of aid, such as SNAP benefits, or any type of assistance, even as simple as educational resources. It's created a lot of fear for our communities, especially across the state of Colorado, where we see an influx of not only undocumented, but mixed status families. Another thing to discuss here in the state of Colorado is by looking at the marginalization that's happened with housing. So we have populations like in other Latinx immigrant communities and communities of color. We have households who are living in a crowded area, and so it's the inability to be able to social distance. And when I mean crowded, what the study showed was individuals who were living more than one person per bedroom, and you know, to some of us, we may think, oh, those are going to be in the urban areas in Denver, but actually what the study found was even though in some parts of Denver there's a large, the population density is high, the crowded housing actually is around the Denver metro areas and in other rural communities of Colorado, for example, upon the San Luis Valley, which I'm excited to hear about, where people are unable to social distance, parts of eastern Yuma and parts of Weld County, where there's communities who are having to live multiple generations within a household and unable to social distance. Particularly around the Denver metro area, if anyone's familiar with the Denver, we have the L shape. The dark orange symbolizes those unable to social distance because of the housing situation. And as we can see, a lot of these communities are the ones who are now living in, that were once in gentrified neighborhoods and are now living out in the inverted L, so Arapahoe County and Adams County. So Adams County, 40% of the population with COVID is Latinx, who's been 40% of the population in Adams County is Latinx. 48% of their cases have been also of COVID with the Latinx community. In Commerce City, we have about 53% of the cases within Latinx, and in Brighton, 42% of the populations within that. And we also start to see some of those pockets within the I-70 corridor, where a lot of these communities who are working in these service industries and the industries that I spoke about earlier. And then I'm going to go to the last part here, and it's just really starting to think about how can we engage in these communities. And this is what a lot of my role has been here at Extension, is really trying to bridge our educators and those who are working within these communities to understand some of the complexities and how to engage within these communities. And a big one is communication, not only within the state of Colorado, but across the country. When COVID started to, the numbers started to influx and the CDC started to bring out information, there was information from the CDC that was being published in English, and it was at least a week behind in Spanish, and not to say the other languages that were also not being translated. So there was information being sent to communities, not proper information, inadequate information, not properly translated information. So what happened was a lot of local communities, especially here in the state of Colorado, started to pool their resources. So we started to see local community members starting to broadcast their own Facebook pages with a lot of the media information. I know here in Denver, we did a partnership with the Spanish radio that we then could broadcast within Facebook to be able to really engage these communities with information that they needed. Social media has been big, even though some of these communities may not have access to a computer. The access to social media and influencing within these communities is great, especially when you can find those local so-called influencers who are shaping these communities. And I just want to end by really trying to understand, as we're looking deeper into this, is really trying to look at community-led initiatives. Each county each county is different with a different, if I'm saying Latinx, there's generational differences. There's different differences within each. So I want to make sure we're keeping that in mind. And Patty's going to be speaking a little bit more about that, and really keeping an inclusive and holistic mindset as we're wanting to go forward with this, so that when another situation and pandemic happens, we are more prepared to be able to provide assistance and address these communities. So with that, I am going to introduce Lori Vigil. And Lori Vigil is the coordinator for the Heart of Saguache in KV for the last 4 years. And she's been a resident there for 42 years. And what she's been working with is doing a grassroots resident teamwork. And I'm happy to see some of her team on this call as well, who are addressing issues of poverty and disengagement in the communities within Saguache and the Lazy KV. So I'm very excited to hear more about what's happening in this local community. Thank you.
Thank you for inviting us to share in your space. First I'd like to share a little bit about Saguache. It's a small community in the north north in the San Luis Valley. And the KV is an HOA property that's about 10 miles outside of Saguache. We have been 60 years of persistent poverty in our area. And our team is the Heart of Saguache KV. We're a grassroots resident team. And like she said, we are working on poverty and disengagement in our community. Distance is an issue for our community. We're a very small community. There's about 500 folks that live in Saguache and probably 300 that are out there at the KV now. It seems to be growing daily. We are about 50 miles from the nearest Walmart or chain grocery. So when the stay-at-home order came out, it was really difficult for folks in our community where we have a small grocery store in our community, but access is difficult. So some of the folks have to travel either to Saguache, to our small grocery store, or we have to travel outside of the valley to get groceries and supplies. So when the COVID came, we first decided that we were going to get community leaders together on a phone call. We meet once a week and we talk about issues that are coming up. The school had issues with internet and getting internet. Because we're so rural, internet as a whole is difficult for us in Saguache. And when we get internet, it's not very good internet. The speeds are pretty low. We have very few companies to choose from. There are only 2 companies in Saguache right now that offer internet access. So the school was able to work with one of them to supply internet to the school, to the students, and they provided them with Chromebooks so that they could work at home. We have the local Saguache Town Market, or Saguache Works, which is the nonprofit that works in our community, also has a small grocery store on Main Street. And supplies we are not seeing as much groceries coming in. I spoke to Saguache Town Market, and they have probably on average about 40% of what they order comes in on the truck now. So that makes it difficult too. So even if we do get things here in the community, it's limited. So first of all, we decided that we were going to reach out to our senior citizens who were the most vulnerable population in our community. And we contacted social services to see what they were doing. We found that only 8 of our senior citizens in our community were taking advantage of the food program and the meal program. And we identified over 80 senior citizens in our community. So we worked with social services and South Central seniors to provide food boxes for 2 weeks worth of groceries to our senior citizens. And we sent about 70 boxes out to those homes. We also found that because food access is a big thing for our folks in the community, we ended up sending out 100 boxes to families and other individuals in the community of Saguache and KV. And those boxes had probably $50 worth of groceries in them, but folks were so happy to receive them. And I visited KV to deliver boxes out there. Some of the things that are out there, there's folks living in small compounds. So there's several structures, not necessarily homes. Some of them are living in boxcars or RVs, old campers, but they live more communally, so distancing is difficult for them. We sponsor families in our community. There were some folks that were being tested because they work outside of Saguache. And when we had an outbreak in Salida at one of the facilities, some of the folks that live here in our community worked there and had to be tested, and so they were quarantined. And we helped those families with food and medical supplies to make sure that they could stay at home and remain safe. We also jumped right on it because we noticed that by the time we get information and we decide to jump on something, we're already 2 weeks out and you can't get supplies. So we jumped on it and we had our quilters work together and they made masks for the essential workers in our community. We also were able to purchase some disposable masks, and we were able to secure N95 masks for our emergency workers in our community. Now what we're seeing is that the amount of groceries that we can get in the store is even less. So yesterday I went back to the grocery store to submit we're getting ready to do another box distribution, and we're getting things that we didn't get before, but now meat is something that we're not able to get in our community. The shelves are bare. They're selling what they do have at a discount because it's expensive for even them to get it. So in rural Colorado where we live, we feel like it's pretty difficult for some of the folks in our community. When we're asking them to stay at home and you have to travel 50 miles to get groceries and expose yourself in another community outside of our community, that's difficult. We're seeing that the students are, I've seen both my son and my daughter are teachers at the school here. And so what we're seeing there is the kids are distancing. It's difficult to keep them focused. I have 2 students in my house too, and it's difficult to keep them on task, and they're going through their own stuff too right now. So emotions run high, and it's the end of the school year where our graduates are saddened that they're not going to be able to celebrate. We are going to be doing a parade down Main Street, and we were able to get banners with photos of all of our seniors that the school will be placing up on Main Street. So we're honoring our seniors in some way, but the ceremony itself is very minimal with just parents and administration, and then everyone else can watch via Zoom. We look forward to a time when we can gather in our community. We have been working on disengagement for quite some time, you know, due to historical trauma in our community and discrimination. There's been a divide for generations, and we were making some progress. And now that we can't come together as a community, it's been difficult. So we reach out, and we are still participating and meeting with our youth once a week, and just to check in and see how everyone's doing and weathering the storm. And we check in with our adult residents now twice a month and see how they're doing. We reach out to our community and to see if there are other needs. We had a senior citizen recently reach out to us who had a hot water heater go out in all of this time too, which is difficult. One of the things that I didn't mention about the KV was where they live and communally they live. Some of the folks live without water, without electricity. When we tell them that they need to wash their hands every day, that's difficult. And the HOA is not consistent with the water services out there. They've had quite a few issues. And so 2 weeks ago, we had to provide them with water. We helped to secure water for them because they were under a boil order on top of all of this. So those are some of the things that we are dealing with in the San Luis Valley, the north end of the San Luis Valley.
Lori, we actually got a couple questions for you, and this is Dawn. I have one myself, but I'll start with Karen's. First, Karen is interested in if you have any meat processors in your area, given there's some agricultural roots, and if are they backlogged if you do? Mm-hmm. And then second, in your community, what are the trusted sources of information for the Latinx population?
So we do have a couple of meat packing places. There's one, again, 50 miles north of us or 50 miles south of us. There are meat packing plants. But what I'm being told from them is that they're also being shorted and having difficulty accessing the meat that we need for our communities as well. So they are limited as well now. And for resources for the Latinx in our community, I don't know that there's a specific organization in the north end of the valley for that, but they do communicate with HEART, and the folks reach out to us. Members of the Latinx community are on our resident team, and we stay in contact with the community to share. We are not like the south end of the valley, where they have a bigger Latinx community than the north end of the valley.
Well, and then this is my question. So I think you gave a lot of really good examples about how you as a community group have woven a safety net some of these folks wouldn't have had otherwise. And obviously you were able to do that this quickly because you had already formulated some kind of network. So if you were going to give people on the call one piece of advice about what was the key thing you've done that made that network be able to respond so quickly and effectively, what would you say it is?
I would say that the weekly call that we have with our community leaders, we meet with, so on the call is county, the town, the school, all of the nonprofits that are working in our community are on that call. And so we're all working together so that we're not duplicating efforts and we're enhancing efforts. And I think that that was probably one of the biggest things that we did, because we all hear from a different part of the community. So sharing what we're hearing and what the needs are for our community collectively was probably the best thing that for our community, for us.
Thanks so much. People can also mute themselves, but if there's other questions, please share them, or otherwise, I know Patty still has some things to share with us as well.
Yeah. So I'm going to do an introduction, but I want to thank Lori. Thank you so much for speaking. I think it's we don't get to hear very much from that area of the state, I know, and especially in our metro area. So thank you so much for sharing that information. Those of you who are in that part of the area and are looking for some resources in the San Luis Valley, the San Luis Valley Immigrant Resource Center is a great one. They have actually someone that's sitting on the health equity response team for the state. So the state has created a health equity response team to look at these inequities within different communities, so disability, within Latinx, within immigrant, and representing from that area, they have someone from the San Luis Valley, so that would be a great one. I also want to state that they have done a wonderful job of also giving resources and trying to engage communities who are non-Spanish speakers, but some indigenous languages like from Guatemala, which we see a large in that part of the San Luis Valley. So with that, I want to introduce Patty Schmidt, who is the director of the Family Leadership Institute at Colorado State University, and she's a longtime expert in community development and civic engagement. She currently directs the FLTI, which we'll be speaking a little bit more, where she's focused on collaborating and building leadership and civic capacity within Colorado communities.
Great, thanks everyone, and hello. I'm excited to be here with everybody today and really follow my colleagues Lori and Erica in such important work, such great examples. Thank you both for sharing the data, the stories about what we're seeing happening in communities, and then how we can work collectively together in order to, you know, not only respond, but also plan moving forward. Sometimes I like to think about, you know, how easy or how great it would be if there was just this easy button that we could press, that we could know right away what we were doing and how we could move forward and, you know, solve these issues, whether it's inequity issues or just things that are coming up right now for communities, no matter who they are. And unfortunately, there isn't that easy button, but I think Lori and Erica both shared some really important information about how we can really begin to understand what's going on in communities and how we can move forward. So that is why I'm here, is to talk about some tools that communities can use in order to do that work. And what I would say is, you know, with Colorado State University Extension, we do a lot of work related to not only planning for emergencies and disasters with several different partners, but we also look at the aspect of response. So how are we responding as a community? And then finally, how can we plan for recovery? And it's a cycle that takes so many different partners and so many different community groups and members to come together in order to create this loose network of collaboration that makes communities stronger. So I'm really excited to see such a diverse group together today so that we can explore an important topic. So our focus for the end of this conversation is really looking at how can we better collaborate together. And what we know through research through the last several decades really is traditional approaches that have been really focused on an agency-led or organizational-led effort no longer is feasible in our rapidly changing communities. And so it's really important from the health sector, from the workforce sector, and even from the school sector, education sector, to look at how can we better collaborate together. A really great example of this is from our education sector. We know that one of the #1 contributing factors for student success is whether or not a school is able to partner with and engage families for that student success. But if you ask teachers and principals what's the #1 task that they have that they really struggle with, they will tell you that it's partnering with parents or engaging families in how to ensure that student success. So the question about how do we collaborate with our community, Erica mentioned that community-driven effort. How do we collaborate with communities? That's a question that people have been struggling a lot, but I think there's a lot of great work that's been done in this area that we're gonna end our conversation with today. Additionally, what we know is that, you know, you know, Lori shared stories about how it's really hard for communities who are living collectively together in communes or in closed settings. It's really hard for people to deny that we're in a rapidly changing world and we are all connected. What's happening in our San Luis Valley is impacting people on the Front Range. And it's important for us to not only look at local efforts, but look at regional and statewide efforts as well. How can we collectively work together across the state of Colorado? And I would argue regionally and nationwide. So one of the important things to think about then is that traditional hierarchical approach where we had decision makers who were saying, hey, on the left, decision makers are telling us what we should do, and then it's the people below those decision makers who really carry out that work. That no longer works. What we really need to begin looking at, or continue to do, as you see is happening in the Saguache community, is collecting these loose networks where there's not one agency, one organization who's saying this is what we're going to do, but instead you have this loose supportive network of people committed to moving together in a way that creates opportunities for innovation and collective work. I always like to bring up the S curve when thinking about, you know, how can you collaborate better within your communities? Because what we know is that change happens quickly. And so the better we can create dynamic systems that embrace that idea that things will not be the same as they were 5 years ago, 10 years ago, or 5 years in the future. But how can we embrace that change is going to happen and look at approaches that embrace that, like systems change approaches. So we are then talking about today about how do we shift gears and look at and embrace collaborative efforts. One of the main tools that a lot of people have really embraced in order to do that is stakeholder engagement. And the premise behind stakeholder engagement is that anybody who's impacted by a complex issue or problem that people are facing, or anybody who is involved in an aspect or work that, you know, is impacted by that work, we need to make sure that we're involving audiences, diverse audiences, and the people impacted or interested in the issue in the decisions that are going to be made. And from the very beginning, I want to be clear, if you're thinking about stakeholder engagement or you're thinking about building stronger collaborative ties in your community, it's important to remember that this engagement has to be ongoing. It takes time. It's never a one event or one conversation, but it has to be a plan that you do year in, year out. It takes resources, it takes leadership support, and it takes people. So when I talk about collaboration, and when I think about collaboration and the collaboration networks that I set up in the work I do with the Family Leadership Training Institute, a lot of what governs my thoughts are around this continuum of engaged scholarship that we have at CSU. Now, this is based on the International Association of Public Participation Spectrum of Engagement, but really it's an idea of when you are engaging with partners and with public and community, you want to think about how am I engaging people across the spectrum. On the left, you have inform and consulting, which I would say a lot of engagement is in that area on the left of the spectrum. But then how can you move your work into collaboration and co-creation? So the further right you can go in your work in partnering and collaborating and co-creating, the stronger the outcomes you can have for your community. So what systems then is the question, what systems do I need in order to strengthen the collaboration that's happening? And this can be based on an issue, it can be based on building systems within your economic structure, it can be on, you know, creating a responsive network to do recovery planning, but really thinking about across that line, where does my work fall and how I collaborate with partners, with community, and how can I strengthen that effort? The biggest focus for that work, and what I think about with our Family Leadership Training Institute work in Colorado, is we know that when a community has a strong civic capacity, they are able to learn together, plan together, and act together. And when a community has a strong civic capacity that can do all three of those things together, they're more likely to be resilient and responsive when things like a pandemic happen. So then, in thinking about how do you engage diverse voices in collaboration, it's important to have an idea of how you're going to engage your partners. So there is all kinds of models on how to do stakeholder engagement. This is one of the ones that I like to talk about because it's based on a feedback loop, and it really represents how stakeholder engagement should be an ongoing process and not something that starts and ends. So in this model from Business for Social Responsibility, it focuses on 5 main steps. And we're going to really dive a little deeper in one of those steps today. But if you have more questions about how to do a stakeholder engagement process for your organization or for a community, please reach out, because we're happy to talk more about what that could look like. So the 5 steps are developing a strategy on how you're going to engage your community. Looking at your second step is mapping the stakeholders who should be involved in the conversation, then preparing for actually doing the engagement. Then the fourth is the actual engagement. So, you know, often that will involve many different techniques, from holding forums, from, you know, doing surveys, to, you know, designing a working group process or a team process that involves that acting piece of getting people involved in what you're trying to do. And then the fifth step is a really important one. It's, you know, designing an action plan. So it's not enough to bring people together and to collect information and collect ideas on what you want to do to be responsive in your community. But you also need to have an action plan that's really clear from day one what the next step will be and who is going to be responsible for what. So I wanted to look, just for today's conversation, to look a little more about the, you know, assessing who should be involved in the conversation. A lot of people refer to this step as stakeholder mapping. So looking at who do you have involved in the work that you're doing or in the effort that you're doing in your community, and who's missing from the conversation. So a lot of times you'll see people, the content experts, those people who are paid to work in that industry, whether it's public health and, you know, the different partners involved in that, to decision makers who are running departments or who are elected officials. What I tend to encounter in stakeholder engagement processes, the people that I most commonly see, actually I'll ask you a question. Who do you think is often missing from community conversations? And I can't see the chat, so somebody's gonna have to help me.
This is Dawn, I'll tell you as they roll in, but the one I put immediately was young families, because
Young families, absolutely. Who else is usually missing from conversations?
receiver of a service.
Receiver of a service, absolutely. Any
Impacted.
other?
Members of the non-dominant group.
Yep. Yeah, members of the non-dominant group. Who holds the power? You know, a lot of times with engagement, I see a lot of people holding these large forums that they say, well, I invited the community, this is who showed up. But when you're thinking about that process, if you're not a part of that dominant group or that majority group, it's not as comfortable for you to show up to that process. So thinking through those different groups who are typically left out. But you absolutely hit it. The biggest group that I've seen that's missing from the process is those mostly impacted by the issue, as well as the potential opponents. So the people who disagree with what you're trying to do. So I would encourage you, when you're trying to think about bringing more diverse voices to the table, make sure you're capturing the voices of people who are often left out, who are most impacted by the issue, and who might disagree with you. Because when you can engage those different voices, you're going to create stronger strategies in your community, which means you'll have larger impacts and outcomes. And just because somebody disagrees with you doesn't mean that they're going to stop you from moving forward. And that's why a good plan and a good process for engagement will help you move conversations forward. And so often it's the community that we see who's missing, those people who are either left out. But what research has told us is that, you know, by engaging people who are most impacted by the issue, you're going to have effective and locally feasible strategies. And Erica referred to this earlier, but this is something, you know, for people who aren't involved with FLTI or the Family Leadership Training Institute in Colorado. One of the things that we really focus with FLTI is how do we strengthen community-driven efforts? And so guiding you in looking at how you can better engage community voices so that you have a stronger capacity for community-driven efforts in your community, there's three key questions you can ask yourself. And I wanted to share a metaphor that I've heard many times, and it's about the dance. So when thinking about equity and creating inclusive processes that allow for diverse voices to be involved in your efforts, a metaphor was once shared with me a long time ago about thinking about this process as a dance. So it's not enough to just invite people to a dance. You also have to invite people to dance once they get there. And then the third piece is, not only do you have to invite them to dance when they get there, but you have to invite them to choose the music as well. And I think that that is really reflective of these three key questions you can ask yourself in assessing whether or not what you're doing is a community-driven effort. So who is doing the participating? Do you only have people who are paid to do that work involved in the conversation? If you do, you're really missing some expertise of that community context expert, the person with lived experience who can really help design some strong strategies within your community. Next, how do you have people participate in your efforts? If you're doing a lot of the talking and people are doing a lot more listening, think about that continuum that I shared earlier, and how can you get more to that level of collaboration and co-creation so that you're designing strategies that are effective and allow other people to set your agendas. When I really embrace, you know, stakeholder engagement and processes that allow for co-creation, it was funny. I'm a type A personality and I'm like, oh, we're going to do this, we're going to do this, we're going to do this. And what I found was when I really embraced that idea of letting other people set the agendas and guide us into the direction we want to go, I've been able to create so many different things that I never thought would be possible. And it was totally different than what I thought our group would do. So highly encourage designing process that allows that to happen. And then finally, who is taking the lead? No one organization or individual should be the person who always takes the lead. Because when that happens and people change or leadership changes, you're less likely to see that momentum continue within your community. So think about, how are you creating a network for action, collective action together? So we presented a lot of data that sometimes can be overwhelming, and we all are seeing different dynamics within our communities, within our own families, and it can get to a point where it can feel so overwhelming that you don't feel like there's a next step. But one possible next step could be, how do you design some collective action models within your community in order to embrace and create change that is systemic? And in thinking about the inequities that really COVID-19 has really brought to light, it is going to take a collaboration. It's going to take community members coming together from different perspectives, really looking at those things. I wanted to mention two other tools that CSU has that can help you in your process. One of those tools is a process called strategic doing. Strategic doing is a tool designed by an economic developer who is tired of helping communities design strategic plans that never did anything. So he developed a process he called strategic doing that was really focused on creating those loose connected networks that are responsive as things come up in communities. It's all about taking the people and the assets that those people control in the room and from day one getting things done. And one of the guiding 4 questions that strategic doing is all about they're such easy questions, but they make a lot of sense and really build momentum for groups. And those 4 questions are: what could we do? What should we do? What will we do? And what's our 30-30? Basically, what are we going to do in the next 30 days? This is a dynamic process that's facilitated, and we've seen across the country in different areas, different sectors, really been a successful way to get momentum going. Another tool that I wanted to mention is something that came out of collective efforts from the Family Leadership Training Institute of Colorado, and it involves several different experts in leadership development, civic capacity building, and practitioners, people who are, out doing great work, coming together and developing a civic capacity index. The civic capacity index, which is almost done, it's drafted, but our final draft should be available this summer, is an index or a diagnostic tool for communities and groups to look at where are they at with their ability within community for community-driven change. And then what the tool does is look for places where resources could be leveraged in order to build a community's capacity for civic or collective action. And what we know is that what research has told us is that when a community has an ability, a strong civic capacity or ability for community-driven change, you're more likely to see it to be responsive and resilient when complex challenges come up in those communities. So we're really excited about the Civic Capacity Index being a place for communities to start looking at how they can strengthen their ability to learn, plan, and act together. So a lot of information, but hopefully some of this will be useful for your work in communities. And I think we have about 10 minutes left, Erica. Should we open it up for any final questions?
Yeah.
I know this is Rebecca. I know there was a question in the chat box for Lori about understanding the funders and the foundations that were active in your community.
So we work under funds from the Colorado Trust. But as far as the other nonprofits in our community, I am not clear as to who their funders are.
Well, just like this is Dawn, just like the question I asked about if there's a compilation for all of these initiatives like Bridge the Digital Divide and Colorado Trust, how easy or not easy do you think it is for communities who aren't quote unquote in the loop because they aren't always invited to the table to actually even find the right access points or entry points to actually get the resources that they need? Is that a continued challenge, and is there a role for CSU in bridging that gap?
Can you repeat that question one more time, Dawn? I started looking to see what questions might be in the chat, so I didn't capture all of it.
Well, just as the list of cool initiatives that people know about going on in different regions of the state, and like she mentioned, she's funded by Colorado Trust. There are all these things that once you're in the know or in the loop, quote unquote, do happen upon and get forwarded to you or you hear about. But is that part of the unintended inequity, is that the networks just don't always include the voices who need to know about the resources best? And is that a role for CSU, is to have somewhere a better compilation or easy navigable guide to like how to get in those loops if you're not in the loops?
Absolutely. And I think that and I'll let you respond to, Erica, but one of the things that's really powerful about creating or focusing collaborative efforts versus, agency-led efforts is that it's designed to not give any one group or agency or individual the power, so that you're more likely to share those resources, and it's feeding a system that is not competitive between agencies, but more collaborative in nature. So when you embrace really collaborating and community-driven change, people are more committed to say, here are some resources that we all can leverage to change what we're seeing going on in our community, versus what can happen where you see a lot of interagency competition for scarce resources.
Yeah, I think I would agree. I think from working from a lot of the communication points where I've been working across the Front Range is really how do we make it accessible? And so there's different components about how different communities are reaching. But if you're looking at highly collective cultures, which a lot of these communities who are facing inequities are, it's building that capacity with that leader within the group. So it may be different than a US standpoint where we see a leader as in one person in front. In some of these collective cultures, it may be an organization, it may be a religious organization, it may be a community housing project. These are collective organizations, and when we approach it, it's really important to remember that that's how we should approach when trying to navigate those spaces, instead of being, hi, I'm the leader and I'm here to give all of this information, because how we encompass power dynamics within some of these communities is also very, very different. And I think there was a question about where to get those sources, Patty.
Yeah, so hi Kavi, it's nice to see your name. And yeah, so reach out to me. We can definitely get you some resources to share those, and then be on the lookout. If you follow FLTI of Colorado on Facebook, we'll be doing once the Civic Capacity Index has its soft rollout, when we make the public announcement about the use of the tool and the training and resources to use the tool, we'll be making a public announcement. And I noticed Karen had a comment. She said that she thought that the role of CSU could be to be at the table when conversations are happening, and be positioned to share with those who might not be at the table or invite others to the table. Absolutely. I agree with you, Karen. Any way we can create inclusive processes and advocate for people to be at that table is really important. I know for me with FLTI of Colorado and the different communities we work, so FLTI of Colorado has different host agencies around the state of Colorado who offer our 20-week curriculum, and often involve a very diverse group of community members from the communities that they're in. And one of the things that I'm really advocating right now for is, as state agencies are doing recovery planning, really advocating for making sure that our family voices and our community member voices who aren't paid to be and do that work are involved in those strategy creations, so that we can make sure we truly are unpacking what has happened and how we can better create systems that don't have such stark inequities in them. So thank you, Karen, that's a great point. And also, I think, the other thing I think about with CSU is, how can we be a bridge between researchers on campus who are doing amazing work and connecting them to local efforts that are happening around the state? Because we have a lot of really committed faculty members on campus who just, are so committed to rural and urban and communities and different groups, and really just want to make communities better. So, and if they can contribute to other people's efforts, they most often than not, they want to do what they can.
So thank you everybody for joining us during this rapid response webinar. Thank you to Lori, Erica, and Patty for coordinating and giving us their thoughts. We appreciate the discussion in the chat as well. It seems like we had a really good discussion. So thank you for joining us. I hope some of you can join us next week, same time at 1 o'clock. We're having, next week's topic is working together, the role of labor in agriculture. So thank you everybody for joining us, and we hope you can, we are recording this and we'll post the recording if anybody wants to share it with others.
Thanks, everybody.
Thanks.